Good day, everyone, and Happy New Year to each and all. My task today is to present the disease glomerulonephritis, the causes, symptoms, and histological implications. So here we go. But before we proceed to the overview or the information about this disease, let's have the following questions first. A question: have you ever experienced the following? The first one is a pink or cola-colored urine from red blood cells in your urine, known as hematuria. The next one is a foamy urine due to excess protein, known as proteinuria. Have you also experienced having high blood pressure or hypertension together with this hematuria and proteinuria? And of course, the fluid retention or the edema, with swelling evident in your face, hands, feet, and abdomen. Now, if you have these following or have experienced the following, you may want to see your doctor or consult a doctor for you have the disease called as glomerulonephritis. So what is this glomerulonephritis? So I have gathered different definitions and descriptions. So the first definition of this disease is that it is an inflammation of the tiny filters in your kidneys known as the glomeruli. Now take note that in each kidney there are around 1 million glomeruli. What is the function of this glomeruli? Now its function is to remove excess fluid, electrolytes, and waste from your bloodstream and pass them into your urine. Now, if these glomeruli are damaged, they lose their filtering ability. As a result, dangerous levels of fluid, electrolytes, and waste build up in your body. And a further result of this is a possible complication of glomerulonephritis, which includes an acute kidney failure. Now, this glomerulonephritis is otherwise known, or it is an umbrella term for a nephritis or a nephrotic syndrome. Now, glomerulonephritis is damaging your tiny filters inside your kidneys, and it is often caused by your immune system attacking healthy body tissues. Now, there are other several causes for this disease. The first one is caused by the immune diseases, just like the lupus, or another one is caused by diabetes. Of course, we can also include the viral infections such as HIV, Hep B, and Hep C. But one common cause for this is the streptococcus infection. Okay, now let's go first with the symptoms of glomerulonephritis. As we have asked earlier, these are the symptoms of the glomerulonephritis. So the kidneys can be badly damaged before any symptoms appear. Now, these are the most common symptoms. Number one is fatigue. Next, we have the hypertension. And we have the edema or the swelling of the face, hands, feet, and belly, and the proteinuria and hematuria. And of course, we have the decreased urine output. So how is this disease diagnosed? So we have 4 tests to be presented here as part of the diagnosis of the glomerulonephritis. The first one is, of course, the urinalysis. Now, this test checks urine for red and white blood cells, infection, or too much protein. So they will have to find out if there are the presence of the red blood cells or the hematuria as a result, and too much of protein or the proteinuria in your urine. Next, we have the blood tests. The test or this test is to measure the levels of waste products to find out how well the kidneys are filtering. Next, we have the commonly used is the kidney biopsy. In this test, the tissue samples are removed from the kidney and checked under the microscope. So they're gonna check if there are inflammation in the glomerulus, and they will diagnose if it is a glomerulonephritis. The last one is the ultrasound of the kidney. This test uses high-frequency sound waves and a computer to make images of blood vessels, tissues, and organs. It's done to see whether the shape or size of the kidney is abnormal. The ultrasounds are used to view organs as they work and to check blood flow through blood vessels. So this is the process for the kidney biopsy. So we have here the biopsy needle, the ultrasound transducer, and of course, your kidney wherein the sample will be getting. And we have here the image of the cross section showing biopsy needle entering the kidney to get the sample. So how is this kidney biopsy done? So we have here the steps for the percutaneous biopsy. When we say percutaneous, the meaning is through the skin, okay, infiltrating through the skin. So the first one for this kidney biopsy is with an ultrasound probe, your doctor identifies exactly where to insert the needle. Now, in some cases, a CT scan may be used instead of ultrasound. Your doctor marks your skin, cleans the area, and applies a numbing medication or a local anesthetic. Then your doctor makes a small incision where the needle will go in and uses the ultrasound device to guide the needle into your kidney. After which you may be asked to hold your breath as your doctor collects a sample using a spring-loaded instrument, and you may feel a pop or pressure and hear a sharp clicking noise. Then your doctor may need to insert the needle several times, often through the same incision, to get enough tissue sample. Your doctor removes the needle and places a small bandage on the incision. So we have here an image of the kidney. Now we're going to discuss how the streptococcus infection can be resulting to a glomerulonephritis. So this is a part of your nephron. And we have here your glomerulus as stated in the arrow on the right side image. Now the function of this is to gather all the fresh blood and filter it and then pass it through the tubule and of course take it out as a urine. Now, if there is a streptococcus infection wherein it usually appears to children about ages about 2 to 10 years old, and then if this streptococcus infection are not treated by the parents or yes, by the doctor, then this will trigger the immune system to create the antibody antigen complexes. And these antigen antibody complexes will be stuck inside the glomerulus, and then it will cause a massive inflammation. Opening, it will, so if you have here your glomerulus inside, and then you will have your, uh, your how do you call them? The ones filtering or the ones catching the filtrate, okay? So it will have a massive, let's say, massive inflammation. So it will open up, okay? It will open up the tube there. And then once the filtrate or once the fresh blood and the proteins are not being filtered well, they are going to pass through this small hole here, and then it will go directly to your tubules and out of your urine system. And that's why we have the hematuria and proteinuria, because the fresh blood and the proteins are not filtered well. The glomerulus are being permeable to this RBC and your proteins. So that's why the symptoms include the hematuria and then the proteinuria. Okay, let's go now to the histological part of this presentation. So we have here the different parts of your nephron and then your glomerulus. So you have here the labels here. And then we have here the normal glomerulus tissue. Okay, so we have here, let's compare later the normal glomerulus tissue and then the ones affected by glomerulonephritis. So if you're going to take note of the dark spots here, okay, and then for the tissue with glomerulonephritis, so there are an increase in the neutrophils or a part of your immune system. So these are the antigen antibody complexes which are being stocked inside your glomerulus. Now, if we're going to compare the tissue with glomerulonephritis and the normal tissue, okay, so on the left side, we have here the normal tissue. Now, this is a post-infectious glomerulonephritis, glomerulus viewed by light microscopy in the left, and the immunofluorescence microscopy in the further right. So, I'm sorry. So we have here the normal tissue here. And if we're going to compare it with the ones affected by glomerulonephritis on the middle image, we can see that there are an increase in the inflammatory cells. So there is a massive inflammation inside the glomerulus. These are the antibody antigen complexes. And because of this inflammation caused by, let's have this clear that this streptococcus is not the ones entering the glomerulus, but it is the streptococcus triggering the immune system and then creating the antibody antigen complexes that is getting stuck inside the glomerulus. And as we can see here, there are an increased inflammatory cells. Okay, now on the further right, we have the immunofluorescence microscopy showing immune complex deposits in capillary walls. Okay, so I think that would be all for my presentation about the glomerulonephritis. Now, I have included here a study which you can visit for as a relation to the ongoing pandemic that we have now. It's the immune complex glomerulonephritis after COVID-19 infection. So there is a part wherein the COVID-19 has affected those people who has this disease and it further infect them. So you can read on this one, and that would be all for today. Thank you so much for my references. I have cited here the sites that you may check. Okay, and again, that would be all. Thank you so much for watching this video, and I hope you will have a prosperous new year. Thank you so much. Goodbye.